My name is Ayn Mann, and I am a 10th grader from Napawine, Washington. While researching behavioral health care in Washington state, I learned that long wait times, provider shortages, and limited youth mental health services continue to be major issues. What steps can the legislature take to improve access to timely and affordable behavioral health care, especially for young people and underserved communities?
Well, thanks for the question. There's no doubt in the legislature that behavioral health continues to need to be a focus of us, especially here in the healthcare committee. And you're exactly right. Lack of timely payments, lack of providers, and just the system overall has needed to be continued to work on. So some of the things that we have done in the legislature over the past couple of years is one, we have worked towards ensuring timely payments for providers, specifically for behavioral health reimbursements. So that's House Bill 1432 that we worked on from last year. And where people are at in their behavioral health needs is not a monolith. So somebody accessing behavioral health as a youth in their school, for instance, is different than somebody that wasn't able to access timely behavioral health resources and becomes in a situation where they're in a place of crisis. So to address the crisis piece, I had been working with first responders, community groups on a bill that I did not sponsor, but Representative Nance did, House Bill 1811, that looks to continue to provide training and resources for workers out in the community. So when someone does go into crisis, you have immediate response from a behavioral health professional. What you see in the community now usually is a firefighter, police officer, emergency medical services, and while we're pretty good at what we do, would it not be better for someone in crisis to have an actually trained behavioral health co-responder that's able to respond in a more timely fashion than just having the fire department show up and take people to the hospital? That's not the best use of resources, and it's certainly not the best way to get people in crisis to the behavioral health resources that they need. It's one of those things where, as society continues to change and evolve between advances in AI and smartphones and social media, we really need to start to tackle and think strategically about behavioral health upstream and downstream, so that way, some of those societal impacts and societal pressures aren't able to get to folks at a relatively young age, that they'll have the tools and resources they need to be able to deal with behavioral health issues if they have them, and make sure that they get timely treatment. So you're exactly correct. The legislature is working on these things, but we're going to continue to need to work on these things in the future. So thanks for the question.
Well, thank you for that question. Behavioral health is incredibly important, and it's a growing need in Washington State. What I have found, I talked to a lot of our behavioral health organizations, and staffing issues is a major challenge. As you might imagine, a lot of staff get burned out. It's a difficult job dealing with this. Obviously, dealing with a lot of stress and difficult situations. And it's also not a highly paid profession. So especially those who are in the Medicaid space, Medicaid doesn't pay a lot. And so there's a lot of turnover. And so that's unfortunate. I mean, some of the organizations I talk to are often run at 50% staffing, which means there's long wait times, hard for people to get in. Sometimes you have people who are ready for treatment and then they can't get in to see a provider. That is really a travesty. So things we can do, we could work on increasing our Medicaid reimbursement rates so that there's a little more money in there to pay a fair wage. We also have training issues, and especially when you get around to psychiatrists and some of that. Washington is one of the most stringent states in the country to get a psychiatry license, with significantly more clinical hours required. So even if a Washington State student wants to become a psychiatrist and goes to school out of state, they often come back to Washington and find out they can't get their license because they don't have enough clinical hours. That's something that should be addressed. I've talked to the dean of psychiatry at University of Washington, and he acknowledges this is a problem. The problem is all the current psychiatrists had to go through this onerous process to get their license, and often they are not overly excited about making it easier for the up-and-comers to come into the profession. So that's something we need to address. We continue to work on streamlining things, reducing regulations where they're not necessary to improve the quality of life for people doing this work, and encouraging people to come into the profession, and making it a more respectable thing to do that makes people want to go into the profession. So there's a lot of things we can do, but it is not an easy solution. Thank you for the question.